Please note that this podcast does not substitute for medical advice. This episode is sponsored by BiomeRenew.
Welcome to another episode of Microbiome Revolution. It's exciting to have an opportunity to speak with Dr. Lushen Pillay, a specialist dermatologist, skin derm in Johannesburg, as well as a consultant at WITS. Thank you so much for joining us. It's always great to have guests on, and especially guests such as yourself. And Dr. Ashley Naidu, once again, always great to have you as well, Ash. Great conversations. We excited to talk more around the microbiome today, and specifically focusing around the skin and the elements of that. We've had a few discussions over the last few episodes. Hopefully the listeners out there are getting to grips with conversations around the microbiome and what we want to do in bringing in some really strong educational facts and the importance just around the power and the potential that the microbiome carries. But before going into that, Lushen, I picked up some interesting facts, and maybe you can tell me if they're facts or not. But one of the great things that I came across, which blew my mind, and I think we sometimes forget this, that the skin is the largest organ in the body, covering around 7 square feet of our body itself. That's an amazing thing, right? So in your perspective and your knowledge of the skin, can you confirm that for us?
So thanks for inviting me, Bert. And 100% correct, it is the largest organ. There are some guys who may say there's something else, but the truth is it is the largest organ. And that's why it's so important for this homeostasis of health in general. You know, a simple thing like they say the skin microbiota influences your gut flora.
Wow.
You know, I mean, I've just learned that recently as well. So there's so many things that are coming out, how important our skin is the first thing that exposed to the environment.
Sure.
So if we control the homeostasis of the skin, the others generally take care of themselves.
That's amazing. So not only is it the largest, but bordering on probably one of the most important, right?
I would say so.
Absolutely. Okay, so another cool thing that I've come across is just like fingerprints, everyone's skin microbiome is unique. I think that's absolutely mind-blowing. Can you confirm that for us?
Yeah, so that's so true. And, you know, we've been working with New York at the Genome Center, with the UK, with Singapore as well. And we're currently doing a study on a South African genome as well.
Wow.
Because each ethnicity, each group, each country has its own microbiome. And it's so important, this whole thing about the exposome, your environment you're exposed to. So, you know, more and more studies are coming up on that. And we're learning more every day on this. And it's mind-blowing. It's fascinating. It's changing the face of healthcare in the world, actually.
Yeah.
So it's an exciting time.
It definitely sounds like that. And just, you know, off the back of what you've said, some of what I've researched and come across as well is very much that. Genetics, environment, diet, other factors is what makes it distinct. And personal. It also links into previous conversations around the 1,000 days, the first 1,000 days with a baby in a baby's life. And of course, we know it can be influenced afterwards as well. But just the incredible kind of ways that our body is influenced by what's around us. It's amazing. This is an interesting pairing. If I look at an orthopedic surgeon and a specialist dermatologist, how did this happen? Tell me more about this.
Yeah, look, I mean, it's been a journey. I'm more than an orthopedic surgeon, I'd like to hope. I'm a person too. I'm a patient too. And I struggled quite a bit with flare-ups of my eczema and my acne, especially around, I would say sometimes climate change and those things. But principally like during COVID and using sanitizers, I noticed my eczema was really out of control. And being in the healthcare space and you're exposed to these alcohols all the time, it was becoming problematic for my job, for me to be able to function. And that road started with a few of us as like-minded individuals looking to strive a change utilizing the microbiome.
Sure.
You know? Try to build towards a solution that could help reduce flare-ups of some of these diseases, but also promote skin health that's bespoke to our climate and our people. And I think skin health is an important factor. I think I've said it before in previous podcasts, but beauty is a byproduct of a healthy skin. You know, that's exactly how we say it. And you know, we always fashion skincare to be female oriented. And we really need to look after our entire skin health as men as well.
Yeah,
I think that point doesn't come across too well, but our microbiomes imprint on each other. So you share a very similar microbiome with your wife, with your children. So you are an influence inside your own household. And starting this road doesn't mean that we were trying to create something that was done before in our market, if we could say this, but we were trying to utilize the very crux of the microbiome to try and build something that could create generational skin health. It helps us reduce antibiotic resistance over time if we can affect change on the microbiome.
Wow.
It's an important factor for any disease process.
I love what you said there around generational skin health. It sounds like an incredible phrase, but even just listening to what you said at the start around how genetics can play a part in terms of the skin and the effects on the skin and the health of the skin as well. Is that something you'd concur with as well, that it could be a generational impact?
No, for sure. And, like Ashley was saying, that early years are so important in a child's development as well, where you build up the good flora, and if I can reiterate again what Ashley's saying about how we got into this. 7-8 years ago, I attend these conferences, international conferences on a regular basis, just wanting to learn what's new all the time. And there was 1 or 2 lectures on the microbiome, on how it affects your skin, your gut health, your autoimmune conditions. I mean, there's an increase in autoimmune illness throughout the world now. And a lot of it is, they're saying, according to your microbiome as well. And now if you go to these all of the conferences, every talk has something on the microbiome. And it's during the COVID time, we thought, skin specialists maybe will be quieter. And so the amount of patients we saw increase with from a personal point of view, I think it's this over-cleaning, over-cleansing, the hygienic hypothesis. If you look at the allergies in the world, it's gone up 300-fold, in the last few years.
Wow.
And I think this over-cleaning we need, is a big part to play in it.
That's very interesting. And we've actually touched on that element in a previous podcast with one of the guests we had on as well, just around allergies and what's been happening.
The clean hypothesis side of things. I mean, there's companies in Europe now that are selling microbiome altered dirt for you to spread on your carpet so that you bring the outside.
We've gone the other way, guys.
If you live in these high-rise buildings away from being in a park, for example, you can bring some of that home so that your kid could develop an immune system.
Wow. Okay, so for people listening in for the first time, or coming across, the skin and the microbiome and so on, also for at early stages or for the first time, how would you basically explain it to someone, the skin, the microbiome, the relationship, etc., in a layman's term format?
Look, Bert, we all have these organisms around us everywhere. Some of them are commensals, some of them are good, some of them are not so good. And the big thing we see is this overuse of antibiotics and things. There's one study showed we have about 4 to 5 million good bacteria on the skin, but one course of antibiotics decreases that to about 2 or 3. And now it takes you months and months and months to build that up. So overuse of antibiotics, there is a place for it. For people who do need it, but we need to be careful and we need to move past that now. To control the skin flora, as we said, it's not everything. Stress and diet, we say, do make a big role in your flora as well. But skincare is one of the things as well. So that's something we can control. We're all living under stress.
Yes.
We can do a bit of exercise. We can sleep better. But how much can you do to control stress? Everyone's living under stress at the moment.
That's true.
And we live in South Africa. we live daily in stress. So the microbiome is a big part to play on that. And if we sort that out, we're going a big way. It's a start.
And I suppose that also just ties into how it relates to skin conditions as well.
Sure.
And you've touched on a few things there. Is there anything particularly that you've seen an increase on in terms of skin conditions? I know you've touched on a few things at the moment with the clean hypotheses, as you mentioned. But anything else that you've come across of and you've gone, wow, okay, this is something that could be assisted or enhanced by how we take care of ourselves?
So if I look at, since I've now started to incorporate all these products that have the postbiotics in it, etc., eczema, acne, and psoriasis are 3 conditions that have gone up throughout the world. It's proper stats, official stats have gone up throughout the world. And if I look at how I've treated my patients, we haven't taken them off all medication, but the amount of drugs that I've needed to use, for acne, isotretinoin and those sort of things where you use in high dosage.
Yes.
I'm now using a quarter of the dosage we used to
Wow.
use, just incorporating it. And I think how it started for me was a few years back, a patient had psoriasis, and I gave them, script all their medication, put them on their oral meds, their topical meds, and I added the products that have the microbiome on it. And the patient came back to me a month or two later and said, my skin's really improved. And I said, okay, how's your side effect with the medication? And they said, you know what, we read some of the side effects, we decided to not use the medication I wrote, which is a bit upsetting as a dermatologist. Didn't take my advice. But the skin improved, and I thought, wow, there's a place for this here.
Something's here.
You know, I mean, not saying to replace everything,
Sure.
but there's definitely a place for it where we can really improve patients' lives. And, you know, skin, if you look at someone's skin, look at someone with good skin and bad skin, maybe it's not right, but they get better jobs. You know, I always do a slide when I talk to my students as well. Which person would you hire? The one with the bad skin or the one with the good skin?
Yeah.
And the people with good skin do get a better jobs. They earn better. You know, they're more likely to have better relationships. And you know, it's little things like that which shouldn't happen, but it's a reality.
And you're so right. It's about how do we improve people's lives? And I think you mentioned such a key thing there. And even the stats that you just mentioned in terms of jobs as an example, even though it shouldn't be that way, because we wired as a certain way with as humans, certain people, I suppose, are just viewed differently. And it could be a confidence thing, it could be a physical appearance or whatever it is. But if we could help someone in terms of improving their life and through using a product or just good advice on what you intake as well, it's massive, isn't it? I don't think we sometimes realize that as people, what role the effect of our skin in terms of our confidence and other areas like that as well. And I suppose, Ash, just coming in and bringing you into the conversation a little bit as well, in terms of, you know, Lushen mentioned postbiotics and, you know, talking through some of the products that are available for these skin conditions that Lushen's talked about. We'll go a little bit deeper with you in a second as well. From your understanding and from your knowledge of that, what have you seen in terms of what people are using, applying, that's been making a difference?
So I'd speak from my professional experience with this space also. You know, I'm one of the practitioners as a surgeon that incorporated the microbiome into surgery very early on, and it's a growing field internationally as well. The way the patients heal cosmetically after surgery has been altered. And I feel that the longer we go down this road of incorporating the microbiome into surgeries, pre-surgical and to recover post-surgical doesn't change the need for the surgery, but gives them a better journey. I think I mentioned this at some point prior, but if you bring a patient into a hospital and they come in under duress and stress and they're about to have surgery, it affects their microbiome. We then go and clean them with alcohol and iodine, and then we kill some of the microbiome. We give them drugs, we give them inhaled gases with the anesthesia, which kills part of your microbiome. And then after all of this killing goes on, we still give you some more antibiotics in your drip, and then send you to the ward where you become a culture medium for every bug that we don't want you to have. And then we get shocked by the fact that you have some kind of infection after surgery. Like it's our practices, and it's a heavy-handedness of medicine that obviously should change over time and start to incorporate more natural solutions, and trying to prehabilitate your microbiome before the insult, if you can, and to use the microbiome itself as a strong point to rehabilitate faster afterwards. What we've noticed is incorporating this into the way our patients recover post-surgery is it's helping them from a cosmetic perspective, it's helping them from a healing perspective, it's helping them from even those that have skin conditions, like you're saying. Like if you've got eczema and you need to have surgery through that area of eczema, you're not going to be the most happy person with the way that process of skin healing is going to go, right? And this gives people access points. I like to say it this way, right? We're getting more procedural with the way we look also. Aesthetics is increasing huge, in Africa massively. Like I think 10 to 1 general practitioners these days enter the aesthetics field versus practicing conventional medicine. So we've got to start looking at
care about how we look.
Well, exactly. And incorporating the microbiome into that has also shown us that if we can work at a surgical perspective, these are conditions and concerns and procedures that are being done on the surface level of what we're doing at a much deeper level anyway. So it's something that we can incorporate into many different fields.
And it's like you're saying, you know, you've mentioned a few things through your response, just in regards to surgery and what's kind of like I suppose a patient is exposed to pre and post surgery. And it's looking at how do we balance some of the effects that might come from using alcohol, for example, to clean the skin or whatever it is. But everything has a place. Some things are required to happen, but how do we rebalance that and give a patient the best chance to also recover, not just from their scarring on a skin or whatever it is.
Functional,
that whole element. Lushen, just in your conversations, because as you've mentioned, you've been attending some of these conferences from about 8 years back, and you can see that the conversations around the microbiome are rapidly increasing and are more widely, I suppose, happening on a wider scale. What would you say in terms of the global conversation that you would have picked up? What are some of the exciting things for you in the developments around the skin and the microbiome?
So, but yeah, as I was saying, it's actually changing again the face of healthcare.
Yeah.
They're going to be able to pick up what your flora is specific to you.
Yeah.
And eventually they'll say, you will be most likely to develop diabetes, hypertension, acne, cancer of this, and so forth. And they'll be able to say, you'll use this specific toothpaste for you. You'll use a specific shampoo for you.
Sure.
And this is tailor-made healthcare. And this is where we're going with it. And, when we go for these conferences, recently there was a psychiatrist speaking about emotional well-being and a decrease in depression by controlling your gut flora and all of these things.
That's incredible,
so it's not just it's much higher than we all realize.
Sure.
And the ENTs, speaking at these conferences, it's become a huge thing with managing the flora of the mouth when they're treating any of these conditions.
That's
but
incredible.
For dentists as well. So it spans across all healthcare.
It's far-reaching.
It's far-reaching, and it's actually an exciting time.
Yeah.
And I think the sad thing a little bit for me is when I came back from these conferences, I'm always trying to speak to the colleagues, and very few do know about it. But I can tell you, it's starting to snowball, and people are starting to realize it makes a difference. And when we're attending these big international conferences, there's a big one in Singapore recently. Every single talk had a little bit on it.
That's
and
incredible.
whoever attended came and said, okay, now we actually realize there's something in play here. So there's more to it, and there's more happening. There's more advancements. My patients who come for their aesthetic treatments, whether they botulinum toxin or the fillers or whatever it is, I've been introducing them to this product, which is so affordable, and they keep on saying, but I'm using a product that's 3,000-4,000 rand. How is it going to compare? And then, you learn from your patients.
Sure.
And they come back and say, wow, I can't believe what's this done for my skin. What's this done? So, you learn from that. And I think there's definitely a bigger play for this, and we can really make a difference in people's lives.
So, you mentioned some of the aesthetic patients that you have, I suppose. So in terms of some of the patients with maybe more common aesthetic procedures that are done that people would be more aware of, where have you seen an increase in people that are using product, that are seeing results in that from some of the aesthetic procedures that you're involved with?
So look, in general, you have your medical conditions we mentioned earlier, your acnes and et cetera, et cetera. But just from an aesthetic point of view, we've now incorporated into our aesthetic treatments, our chemical peels, our laser resurfacing. Yeah. We only use these postbiotic products straight after.
Sure.
There's a glazed peel where your face looks rejuvenated.
Yes.
It was made famous by one of the actresses internationally. We've been using the postbiotics on that. And patients are leaving and said, wow, I can go out straight away. I can look good straight away. There isn't any downtime with this procedure.
Incredible.
We took a group of patients. We said, let's see what it actually does. We took half of the face and we said, let's use the postbiotic product.
Yeah.
And then let's use a product we normally use, which was 3 times the cost. And the results were unbelievable. The postbiotic creams were far superior. And that's it. There's something bigger here. And I think it's going to change the face of aesthetics, medicine in general.
That's so amazing, because you mentioned that immediate effect. Because we live in a society, we want quick results. We are not patient enough with certain things. And of course, certain things you do need to be patient for. But if you have products that are healthy in terms of what it's allowing the body to recover from and giving you quick results, then it's a win-win formula, isn't it?
Definitely.
That's fantastic. Ash, anything you want to add from your side, just in regards to certain things that you've come across, maybe even in just discussions with Lushen or other dermatologists as well, that's really sparked you and gone, wow, this is amazing.
So I think incorporation into conditions is one side of things. A lot of practitioners are looking at it condition-based, but I think our viewpoint on this entire topic has been different. We say pay it forward, right?
Yes.
So if we incorporate this from childhood upwards, you have a better route to aging your skin. Aging is a byproduct of life. You are going to age anyway. But if you age in a healthy perspective, you may not expose yourself to certain conditions. There's even studies that are showing now that sunburn in childhood creates a certain dysbiosis that predisposes you to non-melanoma skin cancer.
Wow.
So if you can break the chain at that level,
yes,
and reinforce a microbiome that may be healthier, you may reduce some of these conditions in the long term. It's much the same like the gut microbiome we spoke about and the Mediterranean diet and finding butyrate as a byproduct of this whole thing. Those short chain fatty acids, if in high volumes in somebody, have been shown to correlate with lower amounts of colorectal cancer.
Wow.
And then we look at areas like Okinawa in Japan, and we look at areas like Greece, for example, where people are living much longer and becoming centenarians much more readily than other parts of the world. And then we realize that there's certain constituents of prebiotics, probiotics, and postbiotics that they're exposed to in their natural diets, in the way they live, in the products that they're using, So it spawns back to that discussion point, right? Like, I love that you said medicine and you said toothpaste in the same sentence, right? It's exactly the way we look at it. How do you define a medicine?
Yes.
Right?
Wow.
Food is a medicine.
Yeah.
It's got thousands of chemicals in it that's derived from God.
Yeah.
Still a medicine.
It's a medicine.
Right? So if you look at it this way,
Yeah.
if you flip over your toothpaste, flip over your shampoo, flip over your face cream, do all of those things, you'll realize the thousands of chemicals that you influence your microbiome with on a daily basis. So how often are we personalizing this to our microbiome?
Yes.
The answer is never. And this is why these kind of movements is trying to grow the microbiome so that we can start to, as you're saying, define the microbiome and the genomics behind this entire thing here so that we can start to make these decisions for ourselves.
Amazing.
Africa is not exactly the investment hub of the world.
Yes.
And we tend to, and I can tell you from personal experience in the medical industries, we tend to get the third and fourth versions of something when the new version is out somewhere else, and that's exactly the point. Like, obviously economics plays its role, but we can't sit back and take that forever.
Sure.
There has to be a movement towards implementing something that's built for our population, built for our climate, built for our concerns, and involve us in the decision making.
Yes.
And I think that's where these kind of things are going to become more powerful over time.
Yeah.
Is that the average consumer in South Africa is going to question these things over time. It's bound to happen. It's happened around the world. People are testing their microbiomes more readily. Like, I'll give you an example. A very similar skin brand, I'd like to say, in France itself, launched skin microbiome testing to the French public with a few adverts, and they were inundated with like 400,000 odd requests for tests in a small span of time. That just tells you that the consumer in certain markets is so educated on this.
And I suppose education
and
information's on the fingertips, right?
Yeah, and personalizing your personal care is important, right? I mean, right, this guy's here, I'm going to say this one, is your bathroom cabinet is like the graveyard for your wife's products. It's true. I mean, there's things that cost a fortune that have passed through my wife's cupboard for a space of 24 hours, and then it's in mine, and it may die a horrible death there. I don't know, right? But all I'm saying is if you could avoid the trial habit, the trial aspect of things, where you try many things and you think because something's more expensive that it is better for you, right? I love the word affordable. I hate the word cheap, right?
Yes,
I think people need to realize that affordable was made to be that way.
Yes.
Right? Cheap is... That's a term that the public would use for certain things. And I think we've got to realize that affordability is where it would influence the market. You need something that could reach from a child to an adult, something that could reach many different households at a price point that's not going to hurt them on their monthly spend, right?
Yes.
I mean, you'll say it as well, right? If you go through a monthly spend of a household, and if it's husband, wife, children, grandparents, and so forth, everybody's got cabinets full of stuff that they use for themselves that they felt worked for them. And if you add up that monthly spend, it could be more than their groceries.
That's incredible.
Probably is more than their groceries.
And I think that's actually a great point, because affordable doesn't mean inferior.
Exactly.
I think that's what we are saying and what we want to see happen, especially with some of the products we will mention shortly as well, that Lushen, you've had an opportunity to use with your patients, because we're seeing that. I mean, affordability is something that is actually a PowerPoint for people. If you can afford something and it enhances your life, it doesn't make it inferior, right? It's an important thing.
And I mean, it's been in the news recently about the rand dollar fluctuation and problems related to that. And you see how that has hurt our industry, right? So bringing it back is, if you have something that is made in the environment you use it as well, you
Yeah.
get to control some of these factors.
100%. And I think the other thing I picked up on what you said is it's around awareness and action, right? So if you start becoming aware of what some of the challenges to your body is in all these various ways, but specifically talking around skin right now, and you're able to take action on that, and you have an affordable solution, then that's power in your hands. And then it's down to you to take action. Lushen, I just want to bring you in here just to talk about a product range that you would have been using on some of your patients. We've actually got some of out on the table as well, because we are hearing and finding that in terms of what BiomeRenew has been kind of doing for patients that are using it, it's been phenomenal. So I'd love some of your insights on that, maybe even some of the type of the product that you've been seeing patients use and have incredible results around as well.
Yes, as I said earlier, but we learn from our patients.
Sure.
There's a lot of products out there which are now saying microbiome friendly, and we've got to be careful as well. It doesn't actually have the active ingredients. You need the postbiotics, the fermented bacteria, to actually make that difference to your homeostasis of your skin flora. So I've been using the microbiome, the BiomeRenew range now for a while, and initially we gave it to a lot of patients to try out, and patients were coming back, and now we're seeing patients buying 20, 30, 40 and taking it overseas to their family. And again, it says a lot about the product. Affordability is important, as we say always, but you need something to be effective and safe as well. And when we, as I said, learn from our patients, we're seeing our patients, our families coming and buying it and taking it to their kids in Australia, taking to their kids in the UK, in Dubai. And we say there is something in this.
Yeah.
So I've been using a lot of the enriched cream, because enriched cream is a rich cream, and it's used for conditions like eczema, like in patients with struggling with dry skin conditions. In Gauteng specifically, we have a lot of dry skin conditions, and it gets worse because of our climate. But also my acne patients who are on medication that dries out their skin. So I've been using a lot of it. I've been using the BiomeRenew ointment, for instance, as a lip balm, as an ointment at night, because it is a thicker product.
Sure.
And I've been using the enriched cream in the day.
Sure.
And then in general, for the aesthetic patients and those patients who generally don't have any issues, and that's why we're saying it has a place for every single patient. It's not just a patient who's got a skin condition.
Yes.
It's a daily product, and moisturizer, it's a lighter product.
Yeah.
And our patients living on the coastline, we see a lot of patients who come from the coast and come to Joburg for their consultations. The daily moisturizer is really nice. It's not sticky. It gets absorbed very well. Non-comedogenic, so it doesn't make the acne worse as well.
That's awesome.
So we like that. And then the big one was the BiomeRenew Scar product.
Okay.
And why I like that is what we were used to using a few products which were quite expensive for patients to use. And we then used this, and we compared it. We compared one leg to the other, one wound to the other, and we saw this was far superior. It's got a high concentration of the postbiotics.
Sure.
So it's not for use, the Scar product is not for use like a face cream. Some people tried using it, but it's for use after you do a procedure.
Sure.
And the results were phenomenal in it.
So when you mention results, like if you had to pick out one or two kind of examples of what really struck you as a specialist dermatologist, you went like, wow, this is amazing. What would you say those were?
So with the patients who develop hypertrophic scars or keloids, which are like thickened scars, which are very common in our darker skin population in South Africa as well. I started using this whenever I did a procedure on them, and little or no keloid scarring. And I thought, this is interesting as well. So there's something more here again. And then I use a lot of the enriched cream. It comes in a big tub. So for my patients who need to use them regularly and use a moisturizer every day on their body, it was an affordable way, and it treated them really well. And we often use it to mix our products in it as well. So we had very good results from that point of view. And again, that ointment, not everyone likes a thick product, but it actually gets absorbed in the skin. It's non-comedogenic. So a lot of people do like it. And my elderly patients seem to come back and say, we really like this. We use it for everything. I had one patient struggling, and he complained of a variety of things, whether he had mites or whatever it is. And he came to me one day and he said, you know what? I use this from head to toe and I feel I'm clear. And that's it. And I said, it worked for you. So
that's amazing. That's really exciting. And also knowing that it is a South African brand, which is incredible. Once again, even talking about how Africa is generally exposed to different products, and to have something that has started in Africa, in South Africa, that is storming the market in many ways in a very positive way with positive results and enhancing patients' lives across the board. That's really exciting. I mean, thinking about the SCAR element, we talked about a little bit earlier around confidence and how a person sees and perceives themselves. Scarring is a huge thing, right? And we know that. And Ash, I know that just your background as well, of course, being an orthopedic surgeon and coming across scars and wounds and so on and so forth, skin related. What would you say? I mean, Lushen's brought out some incredible points. Has that been your experience as well?
It has as well, right? So, I mean, people perceive surgery went well based on what they see on the outside. I mean, this seems to be a common thread. Like people ask it as a third odd question, like,
yes,
not how much their arm is going to bend or whatever. They want to know,
how does it look?
What's it going to look like? How are you going to close it? Am I going to be one of those people?
Yeah.
And I think it's important, right? It helps you to gain the confidence of your patient pool. It helps you to basically give them an option that we know will be better for the immune system also.
Yeah.
And we reduce our risk in the long term by utilizing this. Like there's protocols in place for us to shed bacteria before we go for major surgery by cleaning ourselves with alcohol-based soaps for weeks sometimes before and decolonizing our nose and so forth. And it has shown outcomes to reduce infection in that population. Not to say it doesn't, but is it the only way? And I think this is why we striving to try and create a more natural in and out. That if you take your patient away from a dysbiosis, which is an imbalance between the good and bad bacteria, before we imbalance them by the actions of our surgery, we can always bring them back in a much faster and robust way by prehabilitating and then rehabilitating after.
Wow, that's amazing.
And I think that is something we need to look at over time as well. Is wounds themselves are not sterile in nature. Now with the advent of microbiome testing, we're finding that bacteria ingrowth into a wound once they leave your environment in the hospital happens naturally. There's no way you can stop bacteria from creeping in from every other part of you. But it's the good guys there that are helping to strive the process. We used the analogy earlier about the airbag system, right? Or pre-collision warning, right?
Yes.
You may have the best mechanic in town. Easy gets seen as that, right? But if you had a pre-collision warning system and you avoid the accidents, whose lives
a lot better? Yeah.
Right? It's the same thing here. The microbiome is that guy. They notice changes when bad guys move into their environment. They communicate amongst themselves using chemicals and a very complex way of communicating, and then relay this information backwards to your immune cells inside you. So this is like the front guys that are storming in a war, like they bring back some tactile experience as to what's happening out there. You're going to look at it this way. So we need to nurture them instead of destroying them. And
that's awesome.
And we say that for the longer span of life, we need to live with them.
I love that, nurture rather than destroy, because it has a place and a very important place from what you mentioned as well. Lushen, as we, kind of landing the conversation, what would be some of the, I suppose, advice that you'd want to give to anyone that's listening, that's, interested in the microbiome or wanting to know more about it? How could they do that from a skin perspective? What are some of the, materials that they could read, websites, people they could speak to? Any advice from your side for people listening?
But there's so much. It's an evolving science, so there's more and more things that are coming up. But there's lots on the net, and I think the BiomeRenew guys have been quite good with posting a lot of information, more education workshops like what we're doing now. There's so much to know about it. I think we want just our larger population to know about it and say, there's something going on here. I need to be careful of overwashing, over-cleaning. I need to enhance what I have. Just going off there was 100 kids who were taken with bad eczema, severe eczema. They took those kids, they didn't bath for a year. I'm not saying everyone shouldn't do that. They were smelly, yes, but their skin was much clearer after a year without overdoing all these things. So we just need to say, we need to be aware of this. We need to nourish our skin with the right products. If you look at the Amazon, it's a lush, moist surrounding, and things grow in that. And our skin, we kind of treat it like the Sahara, where it's dry, and if you look at it,
such a good analogy.
So we want to moisturize that area, stop the bugs, the bad bugs from going in, and enhance our barrier and our good bugs and things. And I think there's so much more coming out. There'll be more and more coming out. And what I like about the BiomeRenew is that, there is a social responsibility here to improve the quality of start off with South Africa. We asked South Africans, and for once, there's a product that is made here and affordable,
Yeah.
and it's going to improve all our lives.
That's amazing. That's really, really encouraging. I suppose, like we mentioned earlier, information's at our fingertips, and just knowing what to look into and how that can affect you. If you take action on that, you can improve your life. Ash, anything from your side as we close? Anything that you'd say patients or people listening into this could do to find out more information?
I think following us, I think, is a good idea, because as a group of clinicians, you'll hear varying differences in terms of how we approach the microbiome, and I think it's important to learn it. It's not just about a skincare brand. This is about a way of life, and it influences so many different things, as Lushen has said. So there will be more of these types of discussions to come in various different ways with different types of clinicians and specialists to show you how it should be an integrated way for us to live.
Sure.
And I think, learning from these experiences is not just about us educating ourselves over the next 20 years or so about the microbiome, but it's about sharing this journey with the public, to tell them that it's an evolving science. It's something that's growing and we are learning with it. But to involve the public early with this only puts us as a nation in a stronger position going forward. As a brand that started out in the Southern Hemisphere, we're doing things that the Northern Hemisphere couldn't do at this price point. We're doing things with our approach to things that has costed fortunes in the Northern Hemisphere and has a very small reach. And we feel we want to reinvent this. We want to put the power in the people's hands. We want to make sure that everyone makes these decisions for their kids' health, for their wives' health, for their children, for everyone in your family, And I do think it's something that all of us have to embrace as clinicians over time, that there will be lots of products in this space. And I guarantee that that's going to happen.
Yes.
It's something that is growing, as Lushen said, in many facets, right? Wound dressings, give you an example. There are scientists at the moment now looking at wound dressings to implement microbiome changes at the point of surgery. So these are very important things that will come. And rather than us looking at it at a perspective where it's held away from the consumer, we're doing things with trying to bring this discussion between the consumer and the practitioner early, involve people in their care, involve people in their choices. And I think that's important. They need to be educated for the road ahead.
That's fantastic. I mean, I suppose that is also the society we live in, where we've alluded to a few times, information's at people's tips, but people also want to be involved in making personal decisions, personalized skincare, where it's going and what it could be like in the not too distant future is also very, very exciting. So thank you, gentlemen. Thank you for joining us. Lushen, absolutely fantastic to have you on. I'm sure we'll have you on again with even more information as this is an evolving science. It's fantastic. We will be putting up some links with the podcast itself in the podcast notes. So if you want to find more information on the product range and what it could be used for, that will be useful for yourself. You can find that on there as well. And also just links to certain articles and sites that we can direct you to as you educate yourself. But thank you for joining us for this episode of Microbiome Revolution. It is a revolution. Every time I sit on one of these podcasts, I learn so much. Hope you're learning too, and we'll see you on the next episode.